electromyography or EMG. Our group consists of 4 members, which is me, Alia Ilana, Iza Atira, Rozima, and Leslie Hanan Sumaya. So what is electromyography or EMG? EMG is a diagnostic test that used to record the electrical activity of the muscle at rest or contract, or to measure muscle response, which is electrical activity in response to a nerve stimulation of the muscle. The test is helped to detect neuromuscular abnormalities. So during the test, one or more small needles or called electrodes are inserted through the skin into the muscle. Then the electrical activity picked up by the electrode is then displayed on an oscilloscope or monitor. EMG measures the electrical activity of muscle during rest, slight contraction, and forceful contraction. In the picture, the hand in open hand, rest, so it will make the muscle contract and relax, so it will produce extra potential that will provide information in EMG signal. EMG application. First, control strategy for assistive devices. 2. Disease diagnosis. And lastly, rehabilitation evaluation.
Okay, so now we go to the symptom that's suitable for the test. There are 5 symptoms that's suitable for the test. The first one is tingling. The second one is numbness. Third is muscle weakness. Fourth, burning sensation, and the last one is decreased sensation. Okay, now we go to the disease that's suitable for the test. As you can see, the first one is pinched nerve. Pinched nerve is a compressed nerve surrounding tissue that press on the nerve root that can cause pain, numbness, and tingling in the different way in your body. The second one is sciatica. The sciatica means a pain that radiates along the path of sciatica nerve. Okay, next we have the third one is radiculopathy. The fourth one is carpal tunnel syndrome, and the fifth is myasthenia gravis. Okay, now we go to the next disease. The next disease is the amyotrophic lateral sclerosis, and the next one is muscular dystrophy. Okay, the last one is neuropathy. Neuropathy is a damage of dysfunction of one or more nerve that typically result in numbness, tingling, muscle weakness, and pain at affected area. Okay, now let's go to the risk of the test. EMG is a low-risk procedure and complications are rare. There is small risk of bleeding, infection, and nerve injury where a needle electrode is inserted.
2 types of EMG electrode. First, inserted, which is needle and firewire, and the number 2 is surface.
What is the needle? Method for a needle is EMG. Needle EMG is directly insert the needle to the muscle. More accurate result can be obtained than with surface EMG. The tip of the needle electrode is bent and used as a surface detection. Firewire are extremely fine. They are easily implanted and withdrawn from skeletal muscle, and they are generally less painful than needle use can remain inserted in the muscle throughout the duration of the test. This is example it using surface EMG electrode placement. 1 to 3 for the atrial, lateral, and posterior rectum. 4 and 5 for the long and lateral thoracic brachii. 6 for the bicep. 7, 8, 9 for the brachioradialis, flexor capillaris, and ulnaris respectively. And 10 for the extensor digitorum. So next is procedure of test with appropriate picture. The procedures for inserted test is a needle is inserted through the skin into the muscle. The electrical activity is detected by this needle. Each muscle fiber that contacts will produce an action potential. Patient size and shape of the wave from the action potential are recorded. Recordings are made while the muscle is at rest and then during the contraction.
This is the procedure for surface test.
Here is for the example of result for electromyography. So this picture shows a normal EMG result. When a muscle at rest condition, it will not show any electrical activity, but when it contracts, it will show electrical activity as a waveline or action potential. A normal muscles show a smooth action potential in normal EMG, but normally a very little electrical activity in a muscle while at rest. Inserting the needles can cause some electrical activity. And next one is the result for the patient with broad foot. Broad foot is defined as an impaired ability or inability of dorsiflexion. Peripheral nervous systems injuries can cause this condition. Usually, the ankle dorsiflexion muscles are weakened.